Hello, and welcome back to our channel. In this video, we'll discuss what osteonecrosis is and its impact on joint health. So, without further delays, let's get started. What is osteonecrosis? Osteonecrosis, also known as avascular necrosis, is a condition in which bone tissue dies due to a lack of blood supply. This can occur in any bone in the body, but most commonly affects the hip, knee, shoulder, and ankle joints. The lack of blood supply can be caused by a number of factors, including injury, trauma, medication use, radiation therapy, and underlying medical conditions. Osteonecrosis can cause pain, stiffness, and limited range of motion in the affected joint. If left untreated, it can lead to joint collapse and severe disability. Treatment options depend on the severity of the condition and may include rest, medication, physical therapy, and surgery. Please like and subscribe to our channel and click bell icon to get more health updates. Causes of osteonecrosis: injury or trauma to the bone, such as a fracture or dislocation. Long-term use of certain medications, such as steroids, which can interfere with blood flow to the bones. Radiation therapy, which can damage blood vessels and reduce blood flow to the bones. Chemotherapy, which can weaken bones and increase the risk of osteonecrosis. Medical conditions that affect blood flow, such as sickle cell anemia and lupus. Excessive alcohol consumption, which can damage blood vessels and decrease blood flow to the bones. Blood clotting disorders, which can block blood vessels and reduce blood flow to the bones. Symptoms of osteonecrosis. The symptoms of osteonecrosis can vary depending on the affected bone and the severity of the condition. Common symptoms may include pain in the affected bone, which may be mild at first and become more severe over time. Stiffness and limited range of motion in the affected joint. Swelling and tenderness in the affected area. Weakness in the affected limb or joint. Cracking or popping sounds in the affected joint with movement. Difficulty bearing weight or walking on the affected limb. Treatment options for osteonecrosis. The treatment of osteonecrosis depends on the stage of the disease and the severity of the symptoms. Early-stage osteonecrosis may not require treatment, but close monitoring is essential. Treatment options for more advanced cases of osteonecrosis may include medications. Over-the-counter pain relievers, such as acetaminophen and nonsteroidal anti-inflammatory drugs (NSAIDs), may help relieve pain and reduce inflammation. In more severe cases, prescription medications may be necessary. Rest and immobilization. Limiting weight-bearing activities and using crutches or a walker may help reduce stress on the affected bone and promote healing. Physical therapy. Stretching and strengthening exercises can help improve range of motion, reduce pain, and improve overall function. Electrical stimulation. Electrical stimulation may be used to promote bone healing and reduce pain. Surgery. In more severe cases of osteonecrosis, surgery may be necessary. The type of surgery will depend on the location and severity of the condition. Possible surgical options include bone grafts, joint replacement surgery, and core decompression surgery. Regenerative medicine. Newer treatments such as platelet-rich plasma (PRP) therapy, stem cell therapy, and growth factor injections are being studied for their effectiveness in promoting healing in osteonecrosis. It is important to work closely with your healthcare provider to determine the best treatment plan for your individual needs. Early diagnosis and treatment can help prevent further damage and improve outcomes. Osteonecrosis diagnosis. The diagnosis of osteonecrosis typically involves a physical examination, medical history review, and imaging tests. Your healthcare provider may ask about your symptoms, medical history, and any medications or treatments you have received. They may also perform a physical examination to assess the affected area. Imaging tests, such as X-rays, MRI, and CT scans, can help confirm the diagnosis and determine the extent and severity of the condition. Blood tests may also be ordered to rule out underlying medical conditions that may be contributing to osteonecrosis. In some cases, a bone biopsy may be necessary to confirm the diagnosis, particularly if other conditions, such as bone cancer, need to be ruled out. Overall, an accurate diagnosis of osteonecrosis is essential to ensure proper treatment and management of the condition. Thanks for watching. We would love to hear your thoughts and experiences related to this condition. Have you or someone you know been diagnosed with osteonecrosis? What treatments have you found most helpful? Share your insights in the comments below. And don't forget to subscribe to our channel for more health updates.